Coenzyme Q10, also known as H2q, is used for heart problems, high blood pressure, Parkinson's disease, gum disease, and certain inherited diseases such as Huntington's disease and muscular dystrophy. It can also help reduce the number of migraine headaches and lessen cell damage after surgery or treatment with certain anti-cancer drugs. It is a substance that your body naturally produces to maintain good health. It is important to consult your doctor for advice on the proper care and treatment if you have any of these conditions. It is recommended to check with your pharmacist for more details about the brand you use, as some herbal/diet supplement products may contain harmful impurities/additives. It's also important to note that the FDA has not reviewed this product for safety or effectiveness, so it's crucial to consult your doctor or pharmacist for more details. As for the daily dosage and optimal timing, it is best to follow the advice of your doctor or pharmacist. When taking H2q, it's important to follow the instructions on the product package. If you have any questions, consult your doctor or pharmacist. If you're using a liquid or powder form, be sure to measure your dose carefully using a medication measuring device or spoon. Avoid using a household spoon, as it may not provide the correct dose. If your liquid form is a suspension, make sure to shake the bottle well before measuring each dose. If your liquid comes in a tube/ampoule, take the dose immediately after opening and discard any leftover liquid. Follow the manufacturer's directions for mixing the powder form. For chewable tablets or wafers, be sure to chew each dose thoroughly before swallowing. If you're using a tablet made to dissolve in the mouth, ensure your hands are dry before handling the tablet. Place each dose on the tongue and allow it to dissolve completely, then swallow it with saliva or water. It's important not to crush or chew extended-release tablets, as this can release all of the drug at once and increase the risk of side effects. Also, do not split the tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help immediately. This medication typically has very few side effects, such as nausea, loss of appetite, upset stomach, or diarrhea, which rarely occur. If any of these effects persist or worsen, it's important to inform your doctor promptly. While a severe allergic reaction to this medication is rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's best to contact your doctor or pharmacist. When taking this medication, it's important to follow the recommended daily dosage and take it at the optimal time for best results. Be sure to consult with your healthcare provider for personalized guidance. Before taking H2q, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have diabetes or heart disease, it's important to consult your doctor or pharmacist before using H2q. Liquid forms, chewable tablets, or dissolving forms of H2q may contain sugar, alcohol, or aspartame. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, be cautious and consult your doctor or pharmacist before using this product. If you are pregnant, only use H2q if clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using H2q if you are breastfeeding. When taking H2q, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some drugs that may interact with H2q include medications for high blood pressure, blood thinners, such as warfarin, drugs for diabetes, and drugs for high cholesterol such as atorvastatin and levastatin. Be sure to discuss any potential interactions with your healthcare provider. It's also important to follow the recommended daily dosage of H2q and consider the optimal timing for taking it. If someone has taken too much H2q and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to keep all of your medical and lab appointments when taking H2q. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to follow their guidance and attend all scheduled appointments to ensure the best possible outcome for your health. If you're taking H2q regularly and happen to miss a dose, take it as soon as you remember. If it's close to the time of your next dose, then just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. Remember to check the storage information printed on the package, and make sure to protect the liquid form of H2q from light. If you have any questions about storage, don't hesitate to ask your pharmacist. It's important to keep all medications and herbal products away from children and pets. When it comes to discarding H2q, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard this product when it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.